A pleasant day to everyone, especially to our esteemed research panel, Ms. Maribeth P. Diva, Doc Tony Ann La Chica, Mr. Jobert De La Peña, and to our research professors, Doc Shaila Magbanwa Trajera and Mr. O.J. Ballesteros Jimenez. We are the Group 3B of BSN 3C, and the members are Ms. Wesna, Ms. Loxin, Ms. Madrigal, Ms. Maravilla, Mr. Matulak, and Ms. Medina. And we are here today to present our research entitled Level of Stress Among Nursing Students During COVID-19 Quarantine. Let us start with the background or rationale of the study. The COVID-19 pandemic has affected and altered the lives of millions of people worldwide. A recent review made by Pfefferbaum et al. In 2020 on psychological sequel in samples of quarantined people and on healthcare providers revealed numerous health outcomes, including stress, depression, irritability, some of which persisted after the lifting of quarantine. Online learning will withdraw students from their daily regime and pressure them into learning independently. The shift in learning has forced students to go away from their normal routine, and learning now has to do with how they individually learn on their own. The aim of this study is to determine the level of stress among nursing students in the University of St. La Salle. Let's proceed with the statement of the problem. The first one is, what is the profile of the participants according to sex, year level, and connectivity category? The second, what is the level of stress of level 2 when taken as a whole and grouped according to sex, year level, and connectivity category? And the third one is, what is the level of stress of level 3 when taken as a whole and grouped according to sex, year level, and connectivity category?
For the significance of the study, this study is significant to the following stakeholders. First is the institution. This will serve as a basis for the institution to make changes to its curriculum. Second, guidance counselor. With this study, counselor may find more variables that may lead to mental stress amongst the student and find ways to alleviate the said problem. Third, clinical instructors. Through this research, they will be able to find factors of the new curriculum made in response to quarantine measures that may fact burden students to the point of academic burnout. Fourth, parents. The result of the study may serve as a guide to parents on how to prevent or alleviate said stress and anxiety their students may accumulate. Fifth, nursing students. The result of the study, students should be able to adapt to changes and adjust to the new normal. Lastly, future researchers. This will serve as a guide to the researchers who are preparing to make some related studies. So for our theoretical and conceptual framework, the conceptual framework model that we use is Lasser's stress theory, and this slide will show the relationship between the independent variable, which is the sex, year level, connectivity category, to the dependent variable, which is the level of stress of nursing students during quarantine. For the hypothesis statement, in this study, the researchers hypothesized, 1, there is a significant difference between the levels of stress among BSN students of the University of St. La Salle during quarantine. 2, there is no significant difference between the levels of stress among BSN students of the University of St. La Salle during quarantine.
And these are the methods we use in our study. Our research design is a descriptive quantitative research design. We have 164 participants from the second year out of 277 and 123 participants from the third year out of 164. Our research instrument is the perceived stress scale. Our sampling method is the simple random sampling and Sloven's formula. Our Cronbach's alpha score is 0.83%. Next is our data gathering procedures. First is the sampling of our participants using the simple random sampling and the Sloven's formula. Second, we contact our participants via the messenger application and send them the copy of our letter of consent. Third, the survey questionnaire is sent to the participants along with the instructions. Fourth, the researchers will collect the data and categorize them into set groups. For our statistical treatment, we use the t-test, Pearson's correlation, and the perceived stress scale to quantify the levels of stress on our participants. For our ethical considerations, confidentiality and anonymity will be prioritized. Participants can decide on entering their full name, and any unnecessary data will not be collected. Voluntary participants are free to withdraw from the study, and the researchers will ask permission before collecting the data needed.
Discussion and data. This section presents the conclusion drawn from the result of this study, the set of recommendations addressed to concerned stakeholders followed by conclusion. Table 1. Profile of participants. The 287 participants categorized into 67 males and 220 females, 164 second year and 123 third year students. in their respective network connectivity categories, Category 1, Category 2A, Category 2B, and Category 3. Table 2 shows the result of the level of stress among students when grouped according to sex and year level. It shows that in the second year level, the highest stress level score is 71 and is interpreted as moderate stress, followed by the stress level score of 14 and is interpreted as high stress and low stress in male. The highest stress level score of female is 84 and is interpreted as moderate stress, followed by the stress level score of 15 and is interpreted as high stress, and has the lowest stress level score of 2 and is interpreted as low stress. In the third year level, the highest stress level score of 81 and interpreted as moderate stress, followed by the stress level score of 13 and is interpreted as low stress, and has the lowest stress level score of 6 and is interpreted as the high stress in male. In female, the highest stress level score of 86 and is interpreted as the moderate stress, followed by the stress level score of 11 and is interpreted as the high stress, and has the lowest stress level score of 3 and is interpreted as the low stress.
Let us now proceed to Table 3, Level Stress among nursing students according to year level and connectivity category. Most students have shown moderate stress. In the second year, Category 2A had 67% moderate stress, 2B with 87%, and Category 3 with 74%. In the third year, Category 2A, both high stress and moderate stress were experienced. Category 2B with mostly moderate stress at 90%, and lastly, Category 3 with 73% moderate stress. Table 4, Overall level of stress among nursing students according to sex, year level, and connectivity category. Overall results. In males, 13% are low stress, 76% are moderately stressed, and 10% are highly stressed. Females have 2% low stress, 85% moderately stressed, and 13% highly stressed. For year levels, 4% low stress, 81% moderate stress, 15% highly stressed in second years, while 6% low stress, 85% moderately stressed, and 10% are highly stressed in third year students. Lastly, with the network categories. Category 1 with 100% moderate stress, Category 2 with 4% low stress, 65% moderate stress, and 31% highly stressed. Category 2B with 2% low stress, 89% moderate stressed, and 10% highly stressed. Lastly, Category 3 with 14% low stress, 73% moderate stressed, and 14% highly stressed students.
For the conclusions and recommendations, both male and female nursing students are moderately stressed. However, there are a number of results that shows that females are more stressed than males. Third-year nursing students exhibit significantly moderate level of stress. Stress was also found to be substantially moderate in second-year level nursing students due to the effects of having an online class in this time of pandemic. In this study, the majority of the participants are moderately stressed. Internet connectivity and device availability had inconclusive impact to the stress level, as there are some participants under Category 3 who are not as stressed, but somehow there are still individuals who are still highly stressed. But it is observed that whichever category the participants are placed, the majority of them are still moderately stressed. For the College of Nursing, students' learning would be more effective if interventions such as to reduce academic stress and improve self-esteem are implemented, such as regular online communication and forum for feedback. University of St. LaSalle. The university should carry out comprehensive and in-depth health education and promotion activities to allow college students. The Guidance Department. Guidance counselors should prioritize and establish a plan to communicate and hear the mental needs of the students, such as providing online services by counselors to help students cope with stress. Nursing faculty. The researchers highly recommend the faculty to give time and consideration to adapt in this new form of learning system to provide materials.
Acknowledgements. We would like to give our special thanks to our instructors, Sir OJP Jimenez and Ms. Christine A. Condes for giving us their brilliant knowledge, Dr. Sheila M. Trajera for overseeing our progress, and to our Dean, Ms. IVG Edemni, for the opportunity of us students to pursue our interests regarding the level of stress for nursing students during the quarantine. We are grateful for the chance of itching our curiosities and extracting the answers with our research. We would also like to thank Sir Gilbert P. De Los Santos, Ms. Tony Ann B. La Chica, and Ms. Mirabel Diva for giving us the time of their day to be our panelists for our study. We would like to give our gratitude to our classmates, schoolmates, and teachers who assisted us in the information gathering, data deciphering, and many other things. We would like to give our love to our family, friends, and participants who supported us and enabled this small group of students in search of answers. Once again, these little circle of students with their futures ahead of them would like to give our sincere gratitude to you all. Thank you.